is entitled, today's session is entitled Realizing Housing Stability, Partnership Opportunities with the Disability and Aging Networks. Really, this is a chance to talk about the great work that public housing agencies can play in helping to support the housing and supportive services needs of older adults and people with disabilities. It's a critical role that PHAs play. It is a topic that is passionate and near and dear to my heart. It is the work that I do every day here at HUD. We have a terrific set of presentations and panel discussion. You'll hear from myself, but also from Lori Gerhardt, who's in the room today. Lori is the Director of the Office of Interagency Innovation at the U.S. Administration for Community Living. So ACL is the agency that works with the Aging and Disability Networks. Lori will tell you more about what they do. But what ACL does is it works in partnerships with all of the other offices across ACL, but also across HHS and other federal departments to advance policies and programs that support older adults, people with disabilities, and caregivers to help all of those populations to live full lives in the community. Housing is a priority topic for ACL currently, but also transportation, assistive technology, care transitions, and addressing social isolation and loneliness, and many other areas as well. We then will actually hear from, and actually we could advance the slides a bit. Thank you. We'll also hear a panel from the County of San Bernardino, California. We'll hear from Rashad Mita, who is the Director of Operations for the Housing Authority for the County of San Bernardino. He has almost 20 years of experience working in the housing industry and has actually been with the Housing Authority for about 15 years, overseeing a portfolio of operations of a 3,500 plus unit multifamily properties, along with a voucher program that is more than 10,000 vouchers. We'll also hear from Dr. Juri Thrasher, who's the Executive Director for Knowledge Education for Your Success, otherwise known as KEYS, which is a nonprofit affiliate of the Housing Authority of the County of San Bernardino and one of the largest providers of rapid rehousing and homeless services for individuals, families, children, veterans, and older adults, including those experiencing homelessness. We'll also hear from Julie Burnett, who's the Deputy Executive Director at KEYS. Julie has over 20 years of nonprofit management experience and work in the health and homeless services arena. She joined KEYS in 2013, establishing community systems in county-wide case conferencing, building community partnerships, and leveraging resources with those partnerships in order to serve the most vulnerable populations. Great. So today's session, if we could go to the next slide. Great. So today's session is really about the work that is, I think, critical to support the needs of older adults and people with disabilities. Those of you who have had a chance to read HUD's new strategic plan realize how much we are leaning in on focusing on work that we can do to both help older adults not only have stability and access to affordable housing, but also the wraparound supportive services that will enable them to age in place and to avoid institutional care, and the important work we're doing in partnership with HHS to help support community transitions and community living for people with disabilities. I think really critical to this work is cross-sector collaboration. It is work that HUD and HHS have been doing since the beginning of this administration, where we, from day one, have prioritized our partnership to ensure that community organizations, housing authorities, healthcare providers, services providers can partner locally. And what we want to do is make sure that you all are aware about the opportunities at the federal level, but also to make it easier for you to put together the federal resources, policies, and programs that enable you to form effective housing and services partnerships. So you'll hear a little bit about the federal support and what we're doing, but we'll also hear from the great work that's happening in San Bernardino to link housing and services. So before we dive in, and one thing I want to sort of note is that we, because we're doing this on a hybrid platform, we also want to make this as interactive as possible. So for those of you who are virtual participants, if you could please type into the chat why you are in this session, what you're hoping to hear, and then in a few minutes, we'll ask the staff at CLAFA to help report on some of those responses. And for those of you who are in person, we're hoping that a few of you in the room would be able to maybe tell us briefly why you chose this breakout session, and I'm hoping that there's some great CLAFA staff in the room who have some mics that can run around and hear from you. So with that, our CLAFA team, would you be able to either pass the mic around or read a couple examples for us about why folks have decided to join the session? And we'll just give a few more minutes for folks to type that in the chat if you're joining virtually as well. And we are not hearing any audio from the room. Yeah, we're still not getting any audio on the virtual end. Okay, we're not getting any audio from on the virtual side from the room. Lori, I don't know if your mic was working, if you're able to maybe share with us what is being discussed.
So, Richard, can you hear me at the moment?
Yes. We were able to hear that. It was a little echoey, but keep going.
Yes, I'll work on. Okay.
What mic are you on?
Well, the microphone wasn't working.
We do have 2 comments in the chat that I could read off.
Yes, please. Let's start there.
All right. So we have Alexandra says, I previously worked with adults and children with intellectual and developmental disabilities and would like to learn more about existing partnerships to best serve these populations. We also have Lori put in the chat, presumably from somebody in the room, work for HUD and develop housing with finance and looking to stay current in what is helping the residents.
Great, thanks Ashley for filling in. And for those of you who don't know, Ashley Matthews at HUD, she is with our Office of Public and Housing and oversees our mainstream voucher program. And she is a great person to get to know. Thank you so much for filling in, Ashley. All right, any other sort of thoughts from the chat or from the room? Okay, one more comment in the chat. Interested to learn more how to better serve our older adult population. Great, we will be covering that for sure, Brandy, as well as partnerships combining supportive services and housing programs to support this critical population. So thanks, Corin. We will definitely cover all of that. And then I think we'll hopefully have some time for Q&A. Okay, so we're gonna go into our presentation. I'm gonna kick it off and then I will turn it over to Lori Gerhard shortly, and then we'll move into a panel discussion. So if we could advance to the next slide.
Yeah. I'm
Great.
so sorry. Can you hear me?
The room's a little echoey still.
All right. Okay, well, we will continue with Richard's comments. And we will continue to work on the microphone. I'm sorry, Richard.
Actually, it looks like if I can mute, then the echo goes away. So we'll have to figure out how to coordinate this. Well, I'll keep going. This is and I think somewhere in this is an analogy about the need for effective coordination, because we have to be able to mute our mics appropriately. So want to just share. I think most of you know combining housing with home and community-based services is vital to HUD's mission. We administer several housing programs that are specifically targeted to older adults, people with disabilities, and people experiencing homelessness. And for these three populations, services are not just good to have, they are essential to helping people to achieve success in housing, both to obtain housing, but also to support their ongoing tenancy and their ability to live with dignity, independence, and health in the community. And so we see the set of home and community-based services, or housing-related services, particularly those that are funded and financed by HHS programs, as really vital to support HUD's mission to create strong, sustainable, inclusive communities and quality affordable homes for all. And the next slide. Most of you know this, but we, when we think about our portfolio of housing for older adults, on the one hand, there are specific programs like Section 202, where we actually provide rental assistance contracts within multifamily properties. We have about 6,800 properties that we do asset management for, that total about 330,000 units across the country. In addition, many of our Section 8 project-based rental assistance projects across the country, that includes 11,800 properties with about 1 million units. But and those, while those are not specifically targeted to older adults, we know that about 50% of those properties serve older adults. But actually, the truth is, all of you who are public housing authorities also provide housing for older adults. Our data shows that approximately 158,000 households who live in public housing have a member that is an adult. Sorry, I'm getting the echo from the room. And then within the Housing Choice Voucher Program, about 220,000 households have a member that is an older adult. Next slide. We also provide sort of a number of housing programs that can support people with disabilities. Through our multifamily office, we support the Section 811 program, both capital advance programs that have supported about 2,700 properties that total 30,000 units across the country. And then more recently, the Section 811 Project Rental Assistance Program over the last few years, where we provide rental assistance contracts through awards to housing finance agencies at the state level, requiring them to partner with Medicaid and other agencies to coordinate services, and where we are essentially providing rental assistance contracts within larger affordable housing developments, typically financed using low-income housing tax credits. And we currently have 623 tax credit and other affordable housing properties where there are set-asides of units, 4,700 units to be precise, that serve people with disabilities. In addition, the Section 811 program actually authorizes a voucher program, which many of you probably are very familiar with, the mainstream voucher program, which is specifically intended to serve households with at least one member with a disability. We have, I think, over 50,000. I think that's actually closer to 60,000, over 60,000 vouchers that serve households with at least one member with a disability. Some of you also may be familiar with our NED vouchers, or non-elderly disabled vouchers, similar to mainstream vouchers, except that the households must be headed by a person with disability, and there are approximately 55,000 vouchers under award, most of which are under lease. And then, of course, both public housing and the sort of incremental housing choice vouchers, both quite a few of those units and vouchers serve households with at least a member with a disability. So really, I think when we think about this, a lot of the work that we are doing at HUD is trying to ensure that we are not working within silos ourselves, but that we are working across the different offices within HUD to ensure that we are looking at the full array of housing opportunities for both older adults as well as people with disabilities. Next slide, please. The message I really want to make clear, and I think Lori will certainly emphasize this, is that we actually have available tools today to be able to improve the coordination of housing, of all of the housing that is administered that through those programs, and the wraparound supportive services that enable older adults to age in place, people with disabilities to transition from institutional settings to the community, and to support people experiencing homelessness to transition from homelessness into permanent housing. Medicaid is probably the most important source that covers a variety of what are known as home and community-based services, or more generally, long-term services and supports that can support people's ability to obtain and retain housing, as well as support their community living. And most of our programs are intended to be coordinated with many of these Medicaid financed, as well as other state financed supportive services. All of that requires strong coordination, effective collaboration at this local and at the state level between the various agencies that either provide or finance those wraparound or healthcare services, along with the housing programs that all of you administer. And so the theme today will be really how to really conduct that cross-sector collaboration. Next slide. Of course, we understand this is challenging. One of the things that we've been doing through our work with HHS is to be able to communicate to the HHS stakeholders, so Medicaid agencies, the aging and disability networks that Lori will talk about just the way that the housing system landscape is organized. And as you all know, we have a very sort of complex system. HUD has relationships with state housing agencies. That's to whom we award our Section 811 PRA program. We have capital programs that actually go to both state agencies as well as municipal housing agencies. We provide funding for both public housing as well as for voucher programs to public housing authorities. We provide grants through homelessness continuums of care. And each of those state and local agencies, all of you, work with local housing owners and providers or homeless service organizations. And so I think even one of the most important steps for the healthcare sector is to really understand who are the set of partners. Let me just say, I think many of the healthcare agencies, Medicaid agencies, the Centers for Independent Living, the Aging and Disability Networks, they don't always understand exactly how housing agencies are organized and their different roles. And I think even providing that kind of 101 view is really critical so they can understand the full array of ways to help support the housing needs of older adults and people with disabilities. Next slide. I want to talk about a couple of sort of examples that I think really illustrate kind of the vision for where we want to head to. And I think, I don't know if there's anyone from Vermont in the room, but one of the, I think, really promising examples of effective coordination of housing and services at a systems level is in Vermont, where the Vermont Support and Services at Home project really began in 2011. And what it does is it, through an effort on the healthcare system's part to undertake some reforms and really look at how they could improve outcomes and also reduce costs, particularly for older adults. What Vermont did was actually engage in a process where all of the housing opportunities for older adults was mapped, and the state decided to figure out how to more proactively coordinate and design the delivery of wraparound services to help older adults not only have housing, but also to remain in their housing, have the care in their homes that could help them avoid institutional care. What the state did was then said, with all the different healthcare payers, Medicare, Medicaid, they brought them together and said, we are going to fund 54 service delivery regions, and each of those regions is going to have a healthcare coordinator as well as a wellness nurse. And the job of that coordinator and the wellness nurse was to be able to coordinate the care of all of the residents who live in various HUD-assisted housing, not only Section 202 properties, but also and for project-based rental assistance properties, but also public housing and older adults living in voucher programs, and I think more recently home ownership settings. And that those panels were able to work and coordinate the delivery of all of the Medicaid and finance long-term service and supports, whether that was a personal care attendant or someone to come in and provide supports for people in homes, and where those SASH coordinators really provided the kind of glue to both identify service needs as well as coordinate care across multiple different providers and payers. This is, I think, probably one of the best examples we've seen of kind of a statewide coordinated approach And as far as we know, this is not only working, but also demonstrating improved outcomes, reducing the transition of older adults into institutional care settings, which we know are costly and don't always have the best outcomes. The next slide. Another example is from the state of Louisiana. We could advance. Okay, great. And so some of you may be familiar that in the aftermath of Hurricanes Katrina and Rita, the state of Louisiana received 3,000 vouchers through an emergency appropriation that would really help them address the crisis of homelessness in their state. They realized that with the availability of these vouchers, there was an opportunity to figure out how to really finance wraparound supports. Louisiana actually adopted a number of different Medicaid waivers as well as state plan amendments that enabled them to coordinate a variety of different wraparound services for older adults, but also created a kind of a sort of streamlined single point of access where any person experiencing homelessness who had chronic health conditions could actually apply to obtain these wraparound services as well as apply to obtain vouchers, and the state actually created a coordinated system. And I think that's another great example of where there was a kind of system-wide coordination between multiple different public housing authorities, the state, Louisiana Housing Corporation, along with the Louisiana Department of Health, which is their Medicaid agency. Next slide, please. Great. Actually, we'll skip this one. Okay, so that is that's a sort of view from the HUD side of the equation here about both the programs that we administer, the opportunities we have to partner. The message I want to send is we are doing everything at the federal level to partner with HHS to try to make sure that our policies and our programs are made to be coordinated, really to support that coordination at the local level. I now actually want to turn to Lori Gerhardt, who is with the Administration for Community Living. And if you're not familiar with ACL and the work that they do, you really should get to know them, because I think what ACL's role is really vital in really coordinating across the multiple different agencies that support older adults, people with disabilities, but also serving as a point of coordination across HHS for all the different ways that resources can support older adults and people with disabilities. So Lori, I'm going to turn this over to you, and I'm going to mute myself now.
Okay. Can you hear me, Richard? All right, great. So thanks, everybody, and thanks for bearing with us. This is definitely a partnership that we've got going on. And so in December of 2021, the U.S. Department of Housing and Urban Development and the U.S. Department of Health and Human Services, specifically the Administration for Community Living, the Centers for Medicare and Medicaid Services, the Substance Abuse and Mental Health Services Administration, and the Assistant Secretary for Planning and Evaluation at HHS came together and formed the Housing and Services Resource Center. And this Housing and Services Resource Center is our collective resource center. It really is meant to see how we can strengthen our partnerships at the local level, at the state level, at the national level, to really better serve the same people we serve with housing and services, to help them be in stable housing, get the services that they need to live full lives in the community. And so we're really excited to tell you about that Housing and Services Resource Center today. If you haven't checked it out yet, please do so. It's at acl.gov/housing and services. And we've started with collaborating with our technical assistants. And our website is our first product, where we've linked to all the federal resources that we have knowledge to that can be useful to people working in the housing sector, the healthcare sector, the disability, aging sector, to really learn more about how we can start working more together and leverage some of the resources that are available at the federal, through federal activities. And so if we go to the next slide and the next slide, I'm going to cut through this a little bit. We know that there are some challenges. I think Richard mentioned this. This is not new news to housing folks, right? It's difficult to find accessible housing. It's difficult to find affordable housing. And we also know that it's even challenging for people to get connected to the services they need, the services that really benefit them. And so we see, if we go to the next slide, that there's great opportunity if we begin to bring these sectors together. that, and we really leveraged all of the investments that have been made over time to really focus on the people we're ultimately serving and how we work together to serve that those individuals. So partnerships we see to be an answer. And we also think there's great opportunity. There's been great investment with the American Rescue Plan, and we see opportunity to really leverage those investments. And many of you are probably already taking advantage of those. And then we are finding, as we're talking to all of you, and it's so great to be here with y'all today. I'm hoping I get a chance to meet as many of you as possible, because we're learning about the great innovations that you all have in the field. And we want to help shine spotlights on those and help others see those innovations, because we know together we can address this challenge that we confront as a country, and we can help more people have stable housing and services that they need. So at ACL, if we go to the next slide, our mission is really to help older adults, people with disabilities, and caregivers live full lives in the community. And we do this, if we go on to the next slide, through our disability and aging networks that we fund. And these are at the state and local levels. We fund over 20,000 organizations across the country that are available in all 50 states and the territories, DC and Puerto Rico. And what's really unique about this network that we fund is that they're staffed and operated by the people that live in those communities. So they know the people that live in the communities. They come from the same cultural backgrounds. They understand what services are available in those communities, where there might be landlords and housing available. And they work together to help their neighbors get access to the care and services and the housing that they need. And so we really want to be sure we get connected to the housing sector and to the healthcare sector, because we're serving the same people. And so we want to build more partnerships where we don't have them, and where we do have them, we want to strengthen them. And where we have innovation going about how they came together and really have been able to successfully serve the same people, we want to get those strengthened. I'll tell you real quickly, and I'm going to hand things back to Richard in just a minute. If we go to the next slide. These networks include organizations like Area Agencies on Aging, Centers for Independent Living, Aging and Disability Resource Centers, and state No Wrong Door systems. They include State Assistive Technology Act programs, councils on developmental disabilities, protective services, benefits enrollment centers, and university centers for excellence and developmental disabilities. We go to the next slide, and the kinds of things they help people get connected to include personal care services, where you get an attendant that maybe can help you with bathing, dressing. They also help get you connected to senior centers, home delivered meal programs. They help you understand how to use assistive technology. We know that for every functional limitation that someone confronts, these can be short-term limitations or long-term limitations, that there's an AT device out there that will help them have greater independence with the functional limitation that they're confronting. And the AT programs strive to help people discover those AT devices, learn how to use them, and then help them either obtain them through reuse programs or through state financing programs, or help them use their insurance products to maybe purchase those items. We also help people transition out of, another key service we provide is transportation services, or we help people get connected to those. We know that in order to live in the community, you have to be able to get around. And many of the people that we serve do have some challenges in transportation. And so we do help people get connected to transportation services. And we also help with tenancy supports. And sometimes we're aware of other programs. There are some state funded programs that help people satisfy out old utility bills and assistance with other supports that enable them to get access to the housing they're seeking or use the vouchers that they have. We also help people on the next slide transition out of institutions. A large proportion of the population that are in institutions could be served at home if they had a home and they had the services that they need. And so we're working together to try to help more people that might be institutionalized get back home into the community and be able to live full lives. And then the last item I wanted to just highlight is that through the American Rescue Plan, we received $1.4 billion in Older Americans Act funding to increase the availability of services, particular in-home supports, transportation, assistive technology, preventive services, care transitions, meals, and also programs to address social isolation and loneliness. You go to the next slide. We'll make sure this deck is available to you all, but these are the links on how do you find these organizations in your community. The Elder Care Locator, the Disability Information and Access Line, and the Assistive Technology Act programs can be found through AT3. And we have those links on the slides and we'll provide them. And Richard, back to you.
Great. Thank you, Lori. And I'm going to dive right into our panel. I know we're running a little bit short on time, but I want to make sure we hear from our San Bernardino colleagues. And I'm going to start, Rashad, by just asking you. Sorry for the echo. From the San Bernardino County Housing Authority perspective, what are some of the challenges that you're seeing in serving people with disabilities and older adults?
Well, good morning. We're on the West Coast, so it's still morning in the East Coast. So good morning. Hopefully my audio is okay. You guys can hear me fine. Great. Richard, the challenges we're facing in San Bernardino County are really typical of what the challenges are across the nation. Housing inventory is become very scarce in our county for voucher holders in general. And then when you factor in the needs of elderly populations and the households that have members with disabilities, it just amplifies that challenge because there's a lack of units and then a further lack of, acceptable units for these families. We've seen rent increases that outpace our payment standards. I'm going to try to be careful on how I speak because we're a moving to work agency. So we have things a little bit structured a little bit differently than a traditional PHA. So I'll try to just stick to in the discussion of traditional PHAs. The rental market is exploded in our county. At one point, we were the second highest jurisdiction in the country as far as rent increases go. It's always been Los Angeles County that's been our neighboring county that's been the one that's experienced these great increases. But now San Bernardino County, which is, for those that obviously are not from here, is east of Los Angeles, is now become a tremendously difficult rental market. So finding units has been the biggest challenge. Then finding units and getting a landlord to work within our parameters of paying for those units has been difficult. And landlords are not as keen on working with voucher holders now as they've been in the past because the rental market is so hot out here. California introduced a source of discrimination law back in January of 2020 to address this specific issue. I believe it was Senate Bill 329 that made sure landlords could not discriminate against Section 8 holders. They had to count the income that the subsidy was to the unit. But landlords are savvy, they find ways to kind of work around the programs, and they are, more prone to rent to families that don't have some administrative issues related to the housing, which might be, the inspections, the paperwork that needs to go through. So that's been kind of our big challenge, an ongoing challenge for especially our seniors in our communities. We have a lot of senior designated communities in our portfolio. And what we found over time is a senior, while aging in place, may lose certain self-sufficiency or functionality that they had when they first moved in to the apartment, and that they don't have a family network or a support network that helps them through this aging in place transition. So that's been a big focus of ours too, is to, and I'll talk about it a little bit later on some of the other questions, but kind of addressing not just finding housing, but how stabilizing housing for seniors and individuals with disabilities.
Thank you, Rashad. And just want to remind folks, for those of you joining virtually, if you want to put your questions in the chat as we're speaking, please go ahead and do so. Rashad, I'm just going to ask you a little bit about mainstream vouchers and the work that you're doing to help transition people to the community from institutional settings. What are the kind of partnerships that you have in place, and how have they been helpful to you with the mainstream voucher program?
So our mainstream program has more than doubled in the last 2 years. We started getting awarded competitive allocations, then we got the CARES Act allocation. So our mainstream program more than doubled. We have almost 400 mainstream vouchers right now. So as part of those competitive applications, we started partnerships with many different local organizations that would work with families that would meet the mainstream criteria. So some of them, to give you an example of who we worked with, we wanted to focus on different areas of disabilities, not just focus on one area. So we had organizations that meet different parameters. So we have a partnership with Rolling Start, which is a organization that focuses on individuals with physical disabilities. Then we have a partnership with a group called the Inland Regional Center here, which focuses on individuals with developmental disabilities. And finally, obviously, we have a partnership with our nonprofit Keys, which focuses on homeless families and definitely has a clientele that meet the mainstream criteria within their purview. And also, our county Department of Behavioral Health is a huge partner for us as far as working with families with mental health disabilities. So when we went looking for partners for mainstream, we made sure we were addressing all persons with all kinds of disabilities, not just focusing on one, like physical disabilities or developmental. So I think our partnership kind of structure is really good as far as addressing the need. We have faced a challenge a little bit, which is our main Section 8 tenant, Section 8 waiting list has so many families that meet the criteria for mainstream eligibility. So going through that waiting list and kind of getting the families out of there that meet the mainstream criteria has, had an impact on how many referrals we can accept from partners. But we're very proud of, the whole overall structure of partners that we worked with, because I think we addressed many different areas that this program is designed for.
Great, Rashada, I guess you mentioned Keys as one of your partners. I'd love to hear from Jeree and Julie about the work that you all do to work in partnership with the County Housing Authority.
Good morning, Richard. Thank you. Yes, so I think one thing that has really helped our county make progress in serving our elderly is that several years ago we were able to designate, while we're all required to serve our most vulnerable, right? Our county also designated seniors or our elderly and those with disabilities as a priority. So that allows us to prioritize our services. And so we've also been able to construct service contracts that enables us to build our capacity for our continuum of care network. So we all come to the table with a systems approach to housing that includes housing navigation, focusing on housing navigation for our seniors and those with disabilities. We've also have set aside contracted rooms. So when a senior or elderly is in the community and they're discovered or come forward as being homeless, we have designated rooms available for them. And it cuts through some of that paperwork, allows us to provide stability immediately. And then I think another example would be our housing portfolio, building an inventory of designated homes. We've identified landlords that are willing to work with our seniors or our customers with disabilities, going through identification, inspection to make sure those units are accessible. We make them habitable, right, in terms of the support and services, but also the amenities that they might need. And I think, Julie, if you wanted to add a little about the specifics for those, including maybe the outreach with Sheriff's Hope Team too.
Yes, Good morning, everybody. So one of the things that I really wanted to highlight is, I think I just saw something pop up in the chat, is how is this funded? So it's really critical for us to partner with, and so Keys is able to have contracts with Department of Aging and Adult Services. So we're not making money off of these contracts. We're reinvesting and trying to create these inventories and enhanced partnerships even with our landlords. So some of that, we, instead of shifting from like housing identification, we're really enhancing that landlord relationship. So if the landlord themselves want to do something like shared housing, we're able to work with that property manager who's may already be getting paid, but maybe we're giving them that enhanced incentive on a monthly basis where they're doing that roommate matching. They're involved with the contract with that roommate agreement and the housing agreement. So all of that. So it's the system of us getting the funds, identifying that no wrong door approach with the Department of Aging. Through and Jerry mentioned the Sheriff's Hope team, that's our outreach. So basically, we all get together on a monthly basis and have a case conferencing and a portal where providers can enter in, and we can almost do that pre-prioritization before it goes to CES to see what door that family can go to. So if they meet a rapid rehousing component, we want to make sure they get to that door, a veteran or permanent supportive housing, and even going to the extent of working with our Department of Behavioral Health and identifying some of those that may qualify for emergency housing, and who is going to take the lead, which provider, how can we work together to get them document ready and expedite that process, whether they're in emergency housing or in a even connect it to a program to make sure we're aligning those resources. So we've just done some really creative things in San Bernardino County with making sure that we're securing those units with withholding. We call it a 3-month initial contract. So that, because I think many of our communities, you know, a unit is here today and gone tomorrow, but at post-COVID, it's here today, gone today. So unless we have those built relationships with our landlords and we can actually hold it and do that matching within the 30 days, we can have that unit filled. Our next steps are now looking at creating that shared housing system portal for other providers to start entering their interest. And so we can have that shared housing unit comprised of different, maybe a senior, maybe a veteran, and maybe even our youth populations that are adult youth populations that are looking for housing. And it's really creating those systems of care and so that's really where we are. We're really proud of that work. So I don't know if any other questions came up.
So, I mean, I want to point, I mean, in many ways, HUD's sort of gold standard or straw man for effective services and housing partnerships is the HUD VASH program, where the VA actually provides services and it has that services relationship before they actually help veterans apply for vouchers. In many ways, what you've all done is to apply that same kind of thinking, except you're doing it through other services resources. And I think there's a really effective partnership there. Rashad, I want to point out, San Bernardino was, I think, with the new emergency housing vouchers that HUD provided through the American Rescue Plan, you all were right out of the gate and began really hitting high utilization on those vouchers. And I'm curious how much you think these partnerships with Keys and other organizations has really enabled you to help increase that utilization, and what you see as the benefits of effective partnerships.
Yeah, definitely have played a big part in it. For example, one of the partners I mentioned was the Department of Behavioral Health. They are our largest referring organization for emergency housing vouchers. We received 455 emergency housing vouchers. We received well over 100 referrals from DBH already, just from that one organization. Keys is referring through the program. Many partners that we had were familiar with the whole referral through the coordinated entry system process. So that was a real help, them knowing how to work with CES and work through that process. So it's been a big help. Honestly, the partners that we had been working with on other areas, including mainstream, are the ones that are leading the way as far as EHV referrals.
Great. And Juri and Julie, you mentioned a little bit about the role that you play with landlord engagement and housing search assistance. Can you talk a little bit more about what you've seen to be effective? Rashad mentioned how challenging it is to find units on the private market currently.
Yeah, it really is. I think one of the things that I found is some of the landlords, we got into this stream of incentives. So then landlords that became the norm and expectation. And so we really had to kind of shift that mindset to let landlords know that even from a short-term program like rapid rehousing, we are their long-term investment. And so we're going to find strategies as a continuum of care and resources of how to make sure their rent is paid if we have to do some relocation post-exit. So they know we're that go-to agency that we're going to try to figure that out. And I know like with COC, we can pay 1 month vacancy, or if we have other unrestricted funds that we're using for our housing location and navigation services that we're going to pay some risk mitigation out of. So they know that we're within those agreements that we have, that we want to retain that unit at the end of the day. So if anything does happen and we do have to work on a relocation plan, which there's a small percent of relocations that we have to work on post-exit, maybe, and if things aren't working out, working on some diversion, so reconnecting with other family and friends. So we have to do that work and be there for that landlord in that real time. So we also have a portal for our landlords to communicate those things. So it's almost like a help desk ticket. And then we assign that to our housing navigators to go out and do any kind of mediation and resolution. So having that embedded into our system, they know like Keys is the agency that we want to work with. We do have to look at some of those long-term things of sustainability and working with our county and advocating, and we have to use our data to demonstrate some of those needs and how we're keeping that afloat. But we are seeing some of those trends of because of rentals getting increased and more people becoming homeless. So the demand of services is increasing. So trying to secure that inventory has been a challenge, but we just try to use all of those strategies and our partnership agreements to secure those rooms.
And Richard, I would just add that the collaboration between the Housing Authority, Department of Adult and Aging Services, and the others that Rashad mentioned, it allows us to provide comprehensive but unduplicated services. And then we can identify those potential linkages. So one thing that I think that we've done well in the county is create the expectation for not only our participants, not only our seniors or those with disabilities, but also our landlords, that this is a comprehensive approach. It's a coordinated approach. And so we will leverage our funds and make sure that there's gap fill services, right? So if there's a gap, there will be an agency at the table that can provide that assistance. But and then using that real-time technology, right, to provide information. Julie mentioned the portal for landlords. But the idea is that it increases efficiencies. For example, for the Housing Authority, we can assist. We know that those participants are doc ready because we're familiar. So Rashad mentioned how the information goes out to the coordinated entry system. And we're all aware of what the requirements are for our partners. And so landlords know that in choosing, they're not allowed, right? That expectation is not to pit organizations against each other, but it also provides that level of security for them, knowing that our landlords become part of our network. And therefore, there's that safety net that they're a part of that community, and knowing that, again, it eliminates the competition, if you will, that we can see in terms of that may lead in the worst cases to discrimination or price gouging and things like that. And it keeps us all accountable and effective.
Thank you so much. I'm gonna actually just ask, and Rashad, I might put you on the spot a little bit, which is both through the emergency housing voucher program, we were able to provide, because Congress actually provided these through the American Rescue Plan, additional admin fees and service fees to housing authorities. Kind of curious how those have been effective. With the new mainstream vouchers, we actually just put out a notice that we will be also making available $500 in extraordinary admin fees to per $500 per awarded mainstream voucher to also be able to support those landlord engagement activities. Can you talk a little bit about how your housing authority is using those fees and what your outlook would be for using those to also improve mainstream voucher utilization?
Yeah, sure. As everybody knows, with the EHVs, we got $3,500 per voucher for supportive services. We were very excited when HUD did this. It's one of the first times that vouchers have come with supportive service funds attached to them. We were very excited. What we did find out in the process was that, largely due to just the exponentially increasing costs of rental housing, that the funds did not go as far as we thought they may go for the EHVs. So we partnered with our county and we leveraged emergency solutions grant funds that the county had to supplement the supportive services dollars provided by the EHV program. And the services that we've engaged in to help folks find homes, and I think this format works for mainstream and almost every program, is housing navigation has been the #1 service, helping the applicants or the voucher holders rather find units, find units that are going to be acceptable. They're going to pass HQS. They're going to be the kind of units we want our families to live in. The second thing is assistance with things like security deposits. With escalating rents, security deposits have escalated as well. So our families need assistance with that. We did implement a signing bonus for landlords to just make inroads in this tight market. So there's $1,000 signing bonus for landlords if they get into a HAP agreement with us. And finally, other miscellaneous costs like utility deposits, transportation, and other just tools to help application fees to try and help our families, kind of make headways in this market that's so difficult.
Great, thank you so much. So we have a question in the chat about staffing structure. And the question is, are there any, I think they're really asking Keys about your staffing structure. Do you have any staff internally who are supporting this work, or is it all contracted out? Or and how many internal FTEs do you dedicate? And I'm not sure if that was actually directed at Rashad or to Jury and Julie, but.
Thank you, Richard. This is Shawley Hathaway from the King County Housing Authority. I was actually directing it to Richard because we have in-house resident services coordinators, but we're currently contracting out for navigation services for EHVs to 3 different providers. And we definitely want to enhance services for folks that we're serving. And I'm always curious if folks choose to go in-house or contract out and why.
I think, Richard, that might be for me, so I can take it. Yeah. So from the PHA perspective, budgets are always the question, right? Do we have the funding to, and what's the best way to go about it? So we have the hybrid approach, just like you, Shali. We have for our services for our residents, for our seniors, for our families that need different types of services, we have internal staff. We did not have internal staff for a long time, and we transitioned to hiring 2 full-time resident service coordinators. This is for our housing portfolio that we own, and honestly, we had to make it work in the budget. It worked out of the property operations budgets, but it was the best money we've spent that I can honestly say. The amount of services that these resident services coordinators have brought to our organization is just tremendous. The things we didn't even know existed that they've been able to source and find. And their focus in 2020 was just the pandemic. And we had a real strong focus on our seniors, because our seniors are mostly one single person households. They were cut off from many of their activities, like community center activities and other things that would have contributed to their wellness and stabilization. And that became a real issue for us and concern for us. So there was a lot of focus on our seniors in our community, including we focused on 3 different areas. And I say we, the resident services coordinators, focused on 3 separate areas, including food distribution to our seniors, because especially during the pandemic, we amplified this, capacity building, and then community building. Those are the 3 tranches they focused on. And honestly, we were lucky enough to win an RO award for our services. So they are internal employees as far as the services go. But when it comes to things like housing navigation, especially with EHVs, and being an MTW agency, we're going to be trying to get housing navigation applied to our regular vouchers. We just felt that we did not have the budget or the capacity to take it in-house, so it's contracted.
Rashad, I'm getting the little flag from our CLAFA friends that we're gonna have to wrap up. I'm sure we could have gone on all day long. There's so much to talk about with regard to this topic, but I just want to close out and thank Lori Gerhardt and our colleagues at ACL who are here. Thank you, Rashad and Julie, for the effective work. And I would have loved to hear a lot more about what you're doing in San Bernardino County through these partnerships. I think the main message and theme that you all have heard today is right now it's such an opportunity to be able to use the vouchers and resources we have, coupled with the fees that HUD's providing, the resources that HHS is providing, and the support that the Aging and Disability Networks that Lori's agency oversees provides. There's just great opportunities. But the key is we can find those opportunities when we sit around the table and we actually talk with each other in partnership. And it's great to see that happening in San Bernardino. I'm sure that's happening in many of your communities today. So thank you all so much for this. Thank you, CLAFA, for giving us a chance to highlight the great partnership and work and opportunities here to support people with disabilities, older adults, and people experiencing homelessness. And so with that, I'm going to close this out, and I think the next keynote will begin shortly. Thank you all.
Thank you, thank you, thank you.